Have you ever wondered how technology is changing healthcare? Hello, YouTube. I am back. Welcome to Rapid Nurse. Who am I? Just a nurse with years of nursing experience, making me a nurse of all trades but a master of nothing. These rapid experiences in the healthcare field took a fresh-faced young nurse with boundless hopes for our healthcare and mutated it into an tired, jaded, old nurse. On the channel, we will discuss topics that affect our healthcare. Now, onto the video. How artificial intelligence is used in healthcare. The benefits and risks. Hospitals and healthcare centers are quickly adopting artificial intelligence, AI technology, because it helps them work better and take care of patients more effectively. Experts predict that by 2030, about 38.4% of healthcare services worldwide will use AI, and right now, the AI healthcare market is worth $10.4 billion. Doctors and nurses see the value of AI in giving each patient personalized care, so they're investing in it. As for me, I think if we used AI to make the lives of our patients better, then let's incorporate it in our practice. But if it's being used for collecting and centralizing our biometric data, I would advocate against it. In this video, we'll talk about how using AI in healthcare can make things better, but we'll also look at the risks. Let's get started. Benefits of AI in healthcare. AI and machine learning are transforming the operations of hospitals, healthcare systems, medical groups, and digital health vendors, offering a wide array of advantages never seen before in healthcare. Let's discuss the 4 benefits of AI in healthcare. Number 1. Improved diagnosis and treatment. Artificial intelligence, AI, is like having an above-average assistant for doctors and nurses at your fingertips. It can look at medical information and help us figure out what's wrong with a patient and how to treat them. This is a big deal because it means faster and more accurate diagnoses, which in the short run can save lives. Imagine a doctor trying to read through mountains of patient data, test results, scans, and medical history. It's a lot to take in, considering doctors and nurses are only human. But AI can do this in a flash. It sifts through all that information and picks out the important stuff, like spotting patterns that might indicate a disease or using the search engine with specific criteria to narrow down to a specific diagnosis. For example, let's say a patient comes in with symptoms like fatigue and weight loss. These could be signs of many different conditions. However, AI can analyze the symptoms along with the patient's medical history and test results to come up with a list of possible diagnoses. This helps the doctor narrow down what tests to run and what treatments to consider. Studies have shown that AI is incredibly accurate at diagnosing certain conditions. In one study, AI was better than doctors at spotting certain types of cancer on medical images like X-rays and MRIs. This means earlier detection and treatment, which can make a big difference in outcomes for patients. But it's not just about the diagnosis. AI can also suggest personalized treatment plans based on a patient's unique characteristics. For example, if someone has diabetes, AI can analyze their blood sugar levels, diet, and activity levels to recommend the best combination of medications and lifestyle changes. Now, a message from our video's sponsor, Amazon. Say hello to the ultimate partnership that's about to change your online shopping experience forever. Amazon and Rapid Nurse have teamed up to bring you the best healthcare solutions, resources, and products. And the best part? You can use that special Amazon affiliate link to support Rapid Nurse and shop till your heart's content. What are you waiting for? Let's dive into this amazing collaboration between Amazon and Rapid Nurse. Let's talk about our fantastic partnership between Amazon and Rapid Nurse. By joining forces, we can ensure that viewers like you get the best entertaining items and products at the click of a button. Use the link and order Terminator 2 Judgment Day on DVD or Blu-ray. We are beyond thrilled to be working with Amazon. With their vast resource library, lightning-fast delivery services, and customer-centric approach, it's an incredible opportunity for us to support our user community. Plus, we are both dedicated to ensuring the highest quality products and expert advice to help improve everyone's health and well-being. Now, let's talk about the amazing Amazon affiliate link that's now available for you to use. Here's a rundown of the goods you'll get when using the Amazon affiliate link. Expert advice, guides, and educational resources to help you improve your health and well-being. Access to top-quality, tested, and certified healthcare products directly shipped to your doorstep. You will have the opportunity to support Rapid Nurse by doing something as simple as shopping on Amazon. We are committed to delivering exceptional customer experiences, and our partnership with Rapid Nurse is an integral part of that commitment. With this collaboration, we will be able to make healthcare resources more accessible, engaging, and intuitive than ever before. When you combine the online shopping giant Amazon with the healthcare guru Rapid Nurse, you get a partnership that's as smooth and free-flowing like a catheter tube. Together, they're flipping the pages of healthcare. Hey, while we're at it, don't worry about Amazon and Rapid Nurse abusing data collection. They're all about confidentiality and as trustworthy as a manual blood pressure check. All right, enough talking. It's time for you to use the Amazon affiliate link and help change the world for the better, starting with ordering Dead by Daylight for your console. So don't wait, click it, use it, and start your journey to a healthier, happier you. Number 2, enhanced efficiency and productivity. Artificial intelligence, AI, isn't just about diagnosing diseases. It's also a big help with the day-to-day tasks in healthcare. My daily routine as a nurse would benefit from AI help in the automation and documentation of care. One way AI boosts efficiency is by tackling repetitive tasks, like analyzing medical images. Imagine a doctor having to go through hundreds of X-rays or CT scans every day. It's time-consuming and exhausting. That might explain why some doctors look so unapproachable because of the information overload. But AI can do this much faster and with incredible accuracy. It can spot abnormalities in images like tumors or broken bones and flag them for the doctor to review. For example, in a busy radiology department, AI can help prioritize which images need urgent attention, ensuring that patients with serious conditions get prompt care. AI isn't just limited to medical imaging. It can also handle administrative work. Tasks like scheduling appointments, billing, and managing patient records eat up a lot of time for healthcare staff. But AI-powered systems can automate these tasks, reducing paperwork and freeing up healthcare staff to focus on more important things, like patient care. This is phenomenal if it doesn't replace the human aspect of our care as nurses. Studies have shown that using AI in healthcare can lead to significant time savings and productivity gains. For instance, a study found that an AI system could review and interpret mammograms faster than human radiologists, potentially allowing for quicker diagnosis and treatment of breast cancer. Number 3, AI is more affordable than human healthcare providers. Artificial intelligence, AI, isn't just a fancy tool. It's also a game changer when it comes to saving money in healthcare. If you are a manager, this will be music to your ears, since it's in their job to curb spending. As a nurse, I would like to see no funds being diverted from hiring more nurses for AI. By making things run smoother and cutting down on mistakes, AI has the potential to make healthcare more affordable for everyone. One way AI helps save money is by streamlining processes. Imagine a hospital where everything, from scheduling appointments to ordering medications, is done more efficiently. With AI, tasks that used to take hours can now be done in minutes. This means fewer wasted resources and more time for doctors and nurses to focus on patients. For example, AI can help hospitals manage their inventory of medications and supplies more efficiently, which is next level considering the high amount of medication I have given as a nurse. AI also helps reduce errors, which can be expensive to fix. Think about all the times a simple mistake, like a typo in a patient's medical record, led to costly complications. With AI, these errors can be caught and corrected before they cause harm. This not only saves money, but also improves patient safety. Studies have shown that using AI in healthcare can lead to significant cost savings. For instance, a study found that using AI to assist with medical coding, a tedious and error-prone task, could reduce coding errors and save hospitals millions of dollars in revenue. Whether you're in a state-of-the-art hospital or a rural health unit, AI has the potential to revolutionize healthcare and make sure everyone gets the care they need without breaking the bank. Don't forget to show your support for Rapid Nurse by giving us a thumbs up. Comment in the comment sections and subscribe for more content. Number 4. Health promotion and illness prevention. Artificial intelligence, AI, isn't just about helping doctors and hospitals. It's also changing the way we take care of ourselves, even from a distance. With AI-powered devices and apps, we can keep an eye on our health without having to go to the hospital all the time. When someone has a chronic condition like diabetes or high blood pressure, instead of having to go to the doctor every few weeks for a checkup, they can use a smart device at home to monitor their health. This device can track things like your blood sugar levels or your heart rate and send that information to your doctor in real time. For example, if your blood sugar levels are too high, your doctor can see that right away and give you advice on how to bring them down. This means fewer trips to the hospital and more control over your health from the comfort of your own home. AI also helps doctors provide better care to patients who live in remote areas or have limited access to healthcare. With telemedicine, where doctors can see patients and diagnose illnesses over video calls, AI can analyze symptoms and medical history to help doctors make accurate diagnoses and recommend treatments, even from thousands of miles away. I have seen doctors use this method when I worked in corrections. It was hilarious to see the inmates get angry at a TV after it doesn't prescribe the drugs they are seeking. Studies have shown that remote monitoring and telemedicine can lead to better health outcomes for patients and reduce the need for hospital visits. For instance, using telemedicine to manage chronic conditions like heart failure resulted in fewer hospital admissions and lower healthcare costs. Risk of AI in healthcare. Despite its effectiveness in streamlining operational tasks and processes, it's crucial to be mindful of the risks and disadvantages associated with AI technology. Moving on, let's discuss 4 disadvantages of AI in healthcare. Number 1, data privacy and security risks. When it comes to using AI in healthcare, one big concern is all the patient data it relies on. That is a lot of personal information to have on people or on individuals. I want you to think for a moment about a huge digital library filled with information about people's health like yours. Everything from medical records to test results. That's what AI needs to work its magic. But with all this data floating around, there's a massive risk that it might not be kept safe either from the owners of the AI programs selling your info to insurance companies, or if a black hat hacker gains access to all the personal info and uses it for less than noble intentions. If someone gets access to your medical records without permission, it could be a serious breach of privacy. Your personal information, like your health conditions or medications, could end up in the wrong hands. This is a major worry for patients and healthcare providers alike. For example, there have been cases where hackers targeted hospitals and healthcare systems, stealing sensitive patient data. This not only puts patients' privacy at risk, but also undermines trust in the healthcare system. Moreover, AI systems themselves can sometimes be vulnerable to attacks. If someone manages to hack into an AI system, they could tamper with the data it uses to make decisions. This could lead to inaccurate diagnoses or treatment recommendations, putting our patients' health in jeopardy. To address these concerns, healthcare organizations must prioritize data privacy and security. They need robust systems in place to safeguard patient information from unauthorized access or cyber attacks. And come to terms that such technology is not cheap, and it will require ongoing maintenance costs. Studies have shown that breaches of patient data can have far-reaching consequences, not just for individuals, but also for healthcare organizations. Patients will lose trust in their healthcare providers, or even worse, in an event of a breach, patients could lose their lives. Therefore, healthcare organizations need to invest in robust cybersecurity measures and ensure compliance with data privacy regulations to protect patient confidentiality and maintain trust in the healthcare system. Number 2, bias and discrimination. AI algorithms, like those used in healthcare, can be influenced by biases found in the data they're trained on. Biases are unfair preferences or judgments towards certain groups of people based on things like race, gender, or age. In healthcare, this can mean that AI might make inaccurate diagnoses or suggest treatments that aren't suitable for everyone. For instance, imagine an AI system focused on data from one type of patient, like older Caucasian men. If it encounters a patient who is younger or from a different racial background, it might not perform as well. This could lead to disparities in healthcare, where some groups receive better treatment than others. Research has shown that biases in AI algorithms can have serious consequences. Studies have found instances where AI systems used in healthcare showed biases against certain racial or ethnic groups, leading to disparities in diagnosis and treatment. This is a big problem because it means that some patients might not get the care they need. To address this issue, it's essential to ensure that AI algorithms are trained on diverse and representative data sets. This means including data from people of different ages, races, genders, and backgrounds. By training AI on a more comprehensive data set, it's less likely to develop biases towards specific groups. Regular monitoring and validation of AI algorithms are also crucial. This involves regularly checking to see if the AI is making fair and accurate decisions for all patients. If biases are detected, steps can be taken to correct them, such as adjusting the training data or fine-tuning the algorithm. Number 3, loss of human touch and empathy. Relying too much on AI technology in healthcare can sometimes lead to a loss of the human connection between patients and their healthcare providers. Unlike humans, machines can't understand or show empathy towards patients. This means that patients might not feel as supported or understood when interacting with AI. Let's think about it. When you're feeling sick or scared, having a compassionate healthcare provider to talk to can make a big difference. They can listen to your concerns, offer reassurance, and provide emotional support. Us healthcare workers can provide you with a personal care plan and approach. But AI can't do any of that. It can provide information and make recommendations based on data, but it can't truly understand how a patient is feeling or offer comfort in the same way a human can. For example, imagine a patient receiving a difficult diagnosis from a cold, robotic AI system. They might feel scared and alone, without anyone to offer them a comforting hand or a listening ear. Research has shown that patients value the human connection they have with their healthcare providers. Studies have found that patients who feel supported and listened to by their doctors are more likely to adhere to treatment plans and have better health outcomes. To address this concern, it's important to find a balance between using AI technology and maintaining the human touch in healthcare. This means ensuring that healthcare providers still have meaningful interactions with patients, even as technology becomes more prevalent. Number 4, job displacement and ethical concerns. As AI becomes more common in healthcare, there's a worry that it might replace some jobs and the people who did those jobs. For example, tasks like medical coding or analyzing medical images might be done by AI instead of humans. This could lead to job loss for some healthcare workers, which is concerning. Another big worry is about who's responsible when things go wrong. With AI making decisions in critical medical situations, there's a question of accountability. If an AI system makes a mistake that harms a patient, who's to blame? It's a tricky ethical dilemma that needs to be addressed. Imagine a scenario where an AI system recommends the wrong treatment for a patient, leading to serious complications. Who takes responsibility for that? Is it the healthcare provider who relied on the AI's recommendation, or the developers who created the AI algorithm? These ethical concerns are important to think about as AI becomes more integrated into healthcare. We need to ensure that there are clear guidelines and regulations in place to hold AI systems accountable for their decisions. This might involve things like regular testing and validation of AI algorithms, as well as transparency about how they make decisions. At the same time, we also need to consider the impact on healthcare workers who might lose their jobs due to AI. It's important to provide support and training for those affected by job displacement, ensuring that they can transition to new roles or industries. Do you think they could replace doctors and nurses with AI? Final words. As we wrap up, it's crucial to reflect on the incredible potential of AI in revolutionizing healthcare while acknowledging the challenges it poses. Now, we want to hear from you. What are your thoughts on the role of AI in shaping the future of healthcare? If you enjoyed the video, make sure to give it a thumbs up, hit the subscribe button, and keep the conversation going down below in the comment sections. I do check the comments. And don't forget to share this video with others who might benefit from learning about AI in healthcare. Thanks for watching, and we will see you in the next video. I find it interesting as time goes on and as healthcare rapidly changes, you took the time to view the video. You have my sincere gratitude, thank you. Before I sign off, could I ask you to please like, comment, turn on notifications, and subscribe to Rapid Nurse? This will really help the channel get off life support and deliver a much-needed shot of adrenaline to the heart of the channel.